TV. So we are a bilingual medical channel in which we get different TCM physicians as well as medical doctors up here on our channel. So we'll be discussing a wide range of medical topics that actually affects people's daily lives. So today on my left-hand side, we have Professor Wong Pang Ong. So he's a well-known TCM physician in Singapore. And I'm Dr. Wong Lin Ho. So today our topic, what we'll be touching on is called benign prostatic hyperplasia, or in Chinese we call it 前列腺肿大。王医师，请问什么是前列腺呢？
前列腺它是人体的一个制造那个前列腺液的一个器官，它同时也是一个把那一个精子从那一个精囊里面射出的一个载体。因为我们的射出的精子里面，其实包含的是98%的前列腺液跟周边的那些腺体分泌的那个粘液，但它在性生活中，它起作一个关键的兴奋的一个器官。很多那一些，比如说一些那些喜欢肛交的人，他就是可以不用刺激阴茎，但是它透过那个前列腺的那一个刺激和摩擦，能够得到高潮。
Okay, so prostate itself is actually an organ which surrounds the urethra, which is where our pee actually comes out from. So it usually is about the size of a walnut, about 10 to 20 mm. So what the prostate essentially does is actually it secretes a fluid which joins the semen during ejaculation. So inside the fluid itself, it contains lots of different enzymes, and the enzyme actually helps to provide nutrients for the semen during all this ejaculation. 那王医师，在什么情况下前列腺会肿大呢？
前列腺肿大在中医临床里面大概是分为慢性炎症的感染，或者是那个肾功能的阴阳失调。那至于慢性的前列腺的那些所谓的炎症，一般是临床上会看到那些寡居的那一些没有结婚的男士，他因为时常的勃起之后没有得到很好的宣泄，或者是那一些性生活频繁，而且能练就了金枪不倒的神功，或者是借助药物的那一些作用来延长性活动时间的那些人，因为长时间那一些得不到那个器官得不到很好的修复空间，那一些寡居的人因为没有宣泄，就造就了前列腺的长期的一些炎症，所以这个就是一个炎症的来源。还有一些就是便秘的人，他也许我们的前列腺是挨在那一个直肠的前面所以呢，很多时候会因为的感染而造成他的炎症。另外一些就是一些性生活的男女的交叉感染等等，这些因素很多。所谓的那一些肾的阴阳不足，是因为很多前列腺肿大在年纪比较大的时候才会有。那跟我们的那一些肾的那一些太过，肾在中医里边应该理解为雄性激素，它的分泌太过就造就了它的周边的腺体的组织就会有增生，或者会有些变化。然后在这个间中因为这个腺体本身它是一个就是在性生活中，它是一个起着一个关键的作用，所以很多时候，那些据报道那一些喜欢肛交的人，他不需要去刺激他的阴茎，只需要摩擦或者刺激他的前列腺，就能得到性高潮的作用。所以在这个保护前列腺这一部分，男士应该要慎重的考虑到这个点。
Now, in Western medicine itself, prostate is actually enlarged as we age. But what essentially causes the prostate to enlarge is actually a hormone known as dihydrotestosterone. So DHT itself is formed from testosterone through this enzyme known as 5-alpha reductase. So there's an increase in the enzymatic activity which causes the DHT to increase. So DHT will then stimulate the prostate itself and cause the prostate to have become bigger and bigger, and essentially becomes benign prostatic hyperplasia or BPH as we know it. But on top of that, there's other causes of the prostate becoming larger, such as if the prostate becomes inflamed, and this is known as prostatitis. It can be due to bacterial causes or abacterial causes, and which can be due to many different reasons, such as trauma or any inflammation going on in the prostate. 那王医师，在中医的角度，要怎么治疗前列腺肿大呢？
前列腺肿大在中医临床基本上是根据湿毒，那个肾的阴阳太过或者是不足，还有就是它的那个淤血的那个理论在治疗。一般，根据这一个理论，我们一般采用的古老的方子，一般是中医传统用的那些临床试剂是桂枝茯苓丸、皮屑分清丸、丝妙散，还有一些少腹助理汤之类的哦。那在平时的时候，建议多吃一些番茄。那番茄因为它含有很多番茄红素，还有南瓜子。南瓜子本身它能够抑制那个2氢睾酮的那个对前列腺的影响，使它增生。所以这一些都是很好的一些食物，对前列腺肿大。
你们中医就是常所说的对症下药。
对。
那你们的症方面有什么不一样的那些症状呢？
症状再来讲，在中医来讲，就是小便频密，然后尿急，小便的那一个速度比较慢、细，它的形态改变细，而且它要出力的气把它逼迫出来。还有就是小腹有胀痛感，一般来讲，这些跟前列腺炎有点类似，或者是跟前列腺癌也是有一些相同的地方，所以要在临床上要好好的分辨。
So usually people with BPH, how they will present is that they will have problems with urination. So they will complain of things such as they have problems starting to begin to urine, and they have used lots of pressure to start to pee out. And even when they pee out, the stream of the urine is very poor, and that they will complain that sometimes they cannot hit the wall of the urinal as what they used to. And after they finish peeing, there might be some form of terminal dribbling at the end of it. And on top of that, they might complain that they have to go back to the toilet again because they don't actually complete urinating out everything that's inside the bladder. And some people actually have to get up at night to actually go to the toilet because of that. So all this urine being kept inside the bladder itself might lead to more complications such as they have urinary tract infections, and they might form urinary stones which has to be treated afterwards. So in terms of Western medicine wise, how do we treat it? It's actually a little different from the Chinese medicine way. So we usually give drugs such as alpha blockers. So alpha blockers are drugs which target the bladder neck itself. So it relaxes the bladder neck, allows the urine to flow out, and so that the person actually can pee naturally. But the problem with that is that it actually doesn't prevent the prostate from becoming bigger. So we usually have to add other drugs which target the enzyme, which is the 5-alpha reductase inhibitors. So it prevents the DHT from being formed and the prostate from being larger. So all this we usually start with the medication wise first, then we move on to the surgical treatments. So surgical treatment wise, there are things such as the TURP or transurethric resection of the prostate, where we go in and resect out the prostate itself. And in certain situations, we might just remove the prostate that is blocking the urethra itself, or TUIP. 那 王医师，当一个人说他有前列腺肿大的时候，有什么药物还是食物他不能吃的吗？
一般来讲，在中医里面，麻黄类的药物绝对不能用，因为它能够造就小便不通，所以这个是一个很大的禁忌哦，这个要非常注意的。食物方面，一般来讲，酒类绝对不要沾，因为酒本身它就是一个湿热的那个饮品，所以它会引起湿热下注，而且它本身因为可以加速局部的血液循环，所以会造就它的那个炎症的加剧。哦，所以这个东西必须要清淡，而且吃的食物要很节制。哦，不要暴饮暴食。这个东西运动能够加速局部的炎症的消除。哦，这个要很注意，但是房事也是需要节制。
Okay, so usually we'll recommend patients to have a healthy diet, to actually exercise, and to prevent taking certain medications such as those which are alpha agonists, so such as pseudoephedrine, or in TCM they actually have something called ma huang, which acts similarly because they actually stimulates the alpha receptors. And like what we mentioned just now, we actually give alpha blockers to actually release out the urine. So this alpha this drugs such as ma huang or pseudoephedrine will actually act on alpha channels and make them activated, and therefore prevents the urine from flowing out. So on top of that, we also recommend patients not to drink too much alcohol as well. 那有些人他们说前列腺肿大会造成前列腺癌，请问有这样的依据吗？在中医？
一般来讲，前列腺肿大讲的是良性前列腺肿大。一般来讲的就是它在没有其他的因素的情况下而造就能够癌变的一个可能。那前列腺癌本身它的原因现在还是不明的，其中包括种族啊、遗传啊，或者种种的一些药物等等的一些包括雄性激素之类，可能也是会引起，所以它原因现在还是不明的。但是如果单纯只是一个前列腺肿大，不应该会造成前列腺癌。
So, benign prostatic hyperplasia itself is actually not known to cause prostatic cancer. So people with BPH can actually be assured that it will not progress to prostate cancer. But what we actually know is that certain genes and certain family history, or people who actually have high testosterone level, even though it actually causes BPH, but testosterone itself also will cause the prostate cancer. But there is no such relevance between BPH and prostate cancer itself. OK, 我们今天就谢谢王医师到我们的节目来。If you all have any questions, you can just leave us a comment and then we can answer your questions. Or if you have any topics for us for next week, so we can actually do it on that as well. So, 谢谢王医师，
谢谢。